It's rare. Ebola is one of the world's rarest diseases and is transferred by contact with blood or body fluids of an infected person or an animal, or even contact with a contaminated object like a needle, bedding, or a chair. Like all diseases, there are various strains. The latest outbreak in West Africa is one of the most deadly, but a second outbreak of a different strain has been reported in the DRC. Symptoms include fever, weakness, muscle pain, headache, and sore throat. This is followed by vomiting, diarrhea, rash, and in some cases bleeding. Malaria, typhoid fever, shigellosis, leptospirosis, yellow fever, dengue, and other viral hemorrhagic fevers have similar symptoms and should be considered as more likely unless you've come into direct contact with an Ebola patient, facility, or a region. If you have visited areas where Ebola cases have been reported, seek medical attention if you experience any of the symptoms described. Cases of Ebola have been confirmed in Sierra Leone, Guinea, Liberia, Nigeria, and Senegal, as well as the DRC. Practice proper basic personal hygiene in these regions, including washing your hands, and preferably use rubbing alcohol on your hands as an extra precaution. Do not eat bushmeat, particularly fruit bats, which are believed to be the carriers of the latest outbreak. If you're going to report inside the danger zones, take note of the WHO's notes on how to dress appropriately to ensure safety. The incubation period, which is the interval from infection to onset of symptoms, varies from between 2 to 21 days. People are infectious as long as their blood and secretions contain the virus. Men who have recovered from the disease can still transmit the virus through their semen for up to 7 weeks after recovery. If the risk of exposure is deemed high, for example, you've recently interviewed a relative of a victim who is then also laid low by Ebola, you'll probably need constant observation by a health professional. According to the World Health Organization, it's safe to travel by air to regions affected, but journalists who want to cover the growing health crisis should be aware of the local risks and remain in contact with their embassy or medical staff regarding the changing nature of this outbreak. Always double-check your travel insurance, and if you've decided to go into the infected regions, always maintain contact with the officials. You may also consider a special insurance which could include a mercy flight out of the affected zone, but be aware of the aviation restrictions. Citizens in parts of West Africa are in denial, and others believe Ebola was introduced as a kind of conspiracy by the West. Journalists should be aware of these attitudes and seek local advice.